It's my pleasure to introduce the next session. We've brought together two different funders from Global Implementation Science and a study section reviewer that will provide insights on the process of funding. So we're going to talk about money. So we're going to start with Dr. Gila Neta. Dr. Neta is an epidemiologist and program director for the Implementation Science and the Division of Cancer Control and Population Sciences at the National Cancer Institute. Dr. Neta serves as the NCI scientific lead for the NIH-wide funding announcements and dissemination and implementation research in health. She leads the NIH D&I working group and NIH-wide initiative providing leadership and vision for implementation science across the NIH. She develops research and training activities related to implementation science, both global and domestic, across NCI and NIH. And Dr. Neta is the co-chair of the NIH-sponsored annual conference on the science of dissemination and implementation, and she will be presenting virtually today.
And thank you for that kind introduction. I'm so glad to be accompanied by my colleague, Rachel Sturkett-Fogarty, who also is my partner in all of the efforts you just mentioned. Great. So again, thank you to Dr. Fernandez and everyone at UTHealth for the invitation. I'm excited to talk to everybody about funding for global implementation science at the National Institutes of Health. And as you heard, I am at the NCI, but I have been working with Rachel and others across the agency to coordinate efforts around implementation science at the National Institutes of Health. So I will be talking to you a bit about that coordinated effort. And I will also touch on work from the NCI in global implementation science that you'll be hearing more from Dr. Gravitt and Correa Mendez later in the day. But so for the next slide, I just wanted to remind folks who are not aware that NIH is made up of 27 institutes and centers, and here they are listed. And while implementation science has been growing over the years, really it started with the first cross-agency funding opportunity in 2001 with just a handful of these institutes and centers. As of today, if you advance to the next slide, you can see which ones support implementation science in some capacity. So And so here you can see basically almost everywhere across the NIH, we support implementation science now, and a lot of those efforts include global implementation science. So on the next slide, you can see the funding opportunity that is an NIH-wide funding opportunity that originated with IC institute-specific interests in 2001, but then was issued for the first time in 2005 as a coordinated interagency effort with the recognition that building the evidence around how to support implementation and evidence around ways we can improve implementation of evidence-based interventions is translatable across disease areas, across age groups and settings. And so with that understanding, institutes and centers came together to support this set of funding opportunities, which we are hopeful to be able to reissue again. They will have been on the streets for 20 years in 2025. So here you can see they are called the Dissemination and Implementation Research in Health funding opportunities. There are 3 different mechanisms: the R01, which is the traditional large research study, and then the R03 and R21, which are smaller feasibility pilot studies. And the alphabet soup you see underneath each of those mechanisms is just to show you the different institutes and centers and offices that support these different mechanisms. And across the 3, as I mentioned earlier, there are 23 institute centers and offices who are currently supporting this funding opportunity. At the bottom of this slide, you can see this successful grant applications page. So NCI and members of my team have worked with PIs to make available the full grant applications. Typically, you can read abstracts, those are publicly available, but the specific aims and research strategies are not publicly available. However, PIs who have successfully competed have made those applications available to investigators who may be new to this, to the NIH funding enterprise. And I think those examples of successful grant applications have proven to be one of our most popular websites. So I wanted to mention that resource. And then on the bottom right, you'll be hearing more from Dr. Bala about our study section. That's the review committee, the Science of Implementation in Health and Healthcare. And you can see Dr. Wenjuan Wang is the scientific review officer for that study section that reviews the majority of these applications. On the next slide.
Gila, can you hold on just 1 second? Because there was something that was covering up the bottom, and I think of the slide, and we're going to fix that so everybody can see it. We are going to share the slides though with you.
Great. So I just wanted to mention on this next slide what the stated goals or purposes are for this funding opportunity. And so broadly, it's to support research, to study strategies for overcoming barriers to a range of implementation challenges, whether it's adoption, adaptation, integration, scale up, and sustainability of evidence-based interventions, programs, tools, treatments, guidelines, and policies. In the most recent reissuance, we also highlighted that we want these studies to promote equitable implementation. And while we already know that reach and other factors in the field have inexplicitly focused on equity, there has been, as many know, a greater attention to integrating equity concepts. And so reminding folks that we want to ensure our studies and efforts to improve implementation are in fact equitable and don't further exacerbate inequities. We also call attention to the need for studies to investigate strategies to stop or reduce the use of practices that are ineffective, unproven, low value, or harmful. So a focus on de-implementation, as well as methods and measures studies. And in the most recent reissuance, again, with the impact of COVID, particularly on cancer screening, but for a range of care delivery challenges that are care delivery services that fell off during the COVID pandemic, studies that focus on how best to re-implement evidence-based health services. And I think there's been a lot of interest in particular around bundling or integrating care practices. And so these bullets come from the most recent issuance of these funding opportunities. On the next slide, you can see so over the years, each issuance is on the street for 3 years, and with each reissuance, we add a explicit focus. None of these have been dropped. It's just building upon itself, but essentially, you can see, similar to what I just summarized, over the years, how we have conceptualized and focused on certain areas, all of which we continue to place a high emphasis on. On the next slide, you can see here, so as I mentioned, these are funding opportunities, or maybe I didn't mention it, but meant to, that these funding opportunities are open to foreign applicants and foreign components. And so here on this slide, you can see the countries in which these grants have been funded. I believe that 5 of the 81, either 5 or 7 of these 81 grants across the NIH have been direct awards. And these are the countries in which those grants have been funded. On the next slide. So here I wanted to mention that these funding mechanisms, this dissemination and implementation research and health funding opportunity, the NIH-wide efforts to support implementation science. While many of the institutes and centers have their own funding opportunities, some of them also leverage these NIH-wide funding opportunities through these notices of special interest, which is essentially a notice that indicates there's a particular area that an institute or center wishes to support. And it is a notice to indicate special interest, but not a funding opportunity with set aside funds in and of itself, or a funding opportunity in and of itself. So these notices leverage existing funding opportunities. And here are two examples of notices that have leveraged these implementation science funding opportunities I mentioned to you, where there are particular areas that they wish to explore. And on the right side, you can see the notice led by Dr. Mark Periscandola, who is at the Center for Global Health, NCI's Center for Global Health. And there he essentially sought to leverage these funding opportunities to support D&I research in low and middle income countries and low resource settings broadly. And this initial notice came out as part of a coordinated effort with the GACD. And it has been, to my understanding, one of the most successful notices of special interest in terms of having the most successfully awarded applications through it. So I'm really a visionary and leader in advancing global implementation science at NCI. And on the next slide, which I borrowed from Dr. Periscandola. So as I mentioned, he is at the National Cancer Institute Center for Global Health Research and Training Programs, and they have really built out quite a robust implementation science program, which I have had the great honor to help them launch in those initial years. And on the next slide, you can see Dr. Periscandola just presented this slide at one of our conferences recently that essentially summarizes CGH's implementation science initiatives for global cancer implementation science, to focus on research to improve implementation of evidence-based cancer control interventions, and with a special emphasis on multidisciplinary teams that develop and test strategies for the adoption and sustainability of evidence-based interventions. So they see three critical components to this enterprise: understanding local health and social system context, engaging relevant implementing partners and communities, and promoting equitable participation of LMIC investigators in leading research. And so really this is, and here at the bottom, you can see a range of initiatives that have been funded through CGH for this. Dr. Gravitt has been a major leader, Patty Gravitt, in this, and I believe you will be hearing from her later about more in depth about CGH's initiatives in implementation science. So on the next slide, just to touch on this final bullet, global implementation science for equitable cancer control. This was a CGH initiative to support, which now supports 4 centers for implementation science, 3 in Africa and 1 in Mexico, for which you will be hearing more. Carla Unger is one of the MPIs, along with Dr. Fernandez and Martina Lejus. And essentially the initiative was developed for this purpose, which you can see here on the left, to build research capacity in LMICs for cancer control implementation science, to foster engagement between researchers and implementing partners, and to support research projects in implementation science and cancer control. And this is a graph that Dr. Gravitt developed to conceptualize essentially how the centers work, where you're working. It's a collaboration between LMIC institutions and into leveraging institutional expertise in implementation science around the world to build these centers of research. And I believe Dr. Gravitt may be talking a bit more in depth about this later. So on the next slide, I just want to mention one final funding opportunity for global implementation science. And this comes from an initiative that was developed to focus broadly on pragmatic trials across the cancer control continuum. But pragmatic trials, including trials of implementation strategies, where implementation outcomes are the focus in a range of contexts. And on the next slide, you can see an example of how that funding opportunity was leveraged by the Center for Global Health to focus on pragmatic trials in low resource settings. And Dr. Paul Perlman is the key contact for that. So I think maybe I have only one slide left, which just highlights, it's just a summary to say how, working with my colleagues across the NIH, I think this is maybe a few summary points of the ways in which Fogarty, NCI, NIMH, and others have been building capacity for global implementation science, not just through funding specific research projects, but also through those initiatives to fund centers, and with an explicit a focus on incentivizing engagement with implementing partners, hosting platforms to foster networking and capacity building, and also funding mechanisms to support engagement. And here's just one example that CGH supports, but I believe Rachel Stirk will be talking more in depth about examples of these things. So with that, I will pass it on to you, Rachel. Thanks.